Good afternoon, and welcome to AskTheHealthSystemCIO.com All-Stars, Rethinking Data Management for Innovation and Growth, a complimentary webinar from HealthSystemCIO.com sponsored by Optum. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com, and I'll be your moderator today. We encourage you to ask questions at any time. We're going to have a free-flowing discussion with our panelists. You can go ahead and type your questions into the Q&A box in the lower right-hand corner of your screen and leave the default set to all panelists. So go ahead and send those in as they occur to you, and we may just jump right in with them. We've got the deck will be available today. You've got the URL in front of you. There's a shortened URL at the bottom of all slides, and I did send it out in the chat box, but if you need it, go ahead and let me know. Otherwise, you should be able to go ahead and grab it. And we are recording today's event, so you will get an email when it's been posted to our YouTube channel, usually within 2 business days, if not sooner. So we're going to go about 45 minutes today. First, we're going to have our panel discussion with our panelists, who you see in front of you. Then we're going to get a word from our sponsor, from Russ Lawrence, Director of Data Management Strategy for Healthcare with Optum. And then we're going to finish up our Q&A. So I want to give a little background of the topic before we get started today. So I want to set the table a little bit by quickly looking at where we've come from, where we are now, and where we hope to go in this area. Now, it seems to me that we are entering a new phase in the electronification, if I can use such a word, of healthcare. In the first phase, which would be the EMR adoption phase, the Holy Grail was basically to select a system, and this often took over a year, this whole process, and then to go live. And to say you'd gone live was to be a very successful CIO. The next step was to become a CIO who had brought a system live that people were actually using. So then we really started looking at CPOE usage and how many of the docs were actually putting in their own orders. Of course, there were questions around the usage of scribes and whether or not that counted towards your number. But the second phase was really about putting in a system and having folks use it to enter orders and notes. And now nobody seems to be talking much about that kind of activity anymore. We all assume that you've selected a system, gone live, and that folks are using it. We all assume that you are accumulating tons and tons of data. And now we're talking about whether or not the system is helping your clinicians deliver better, smarter care, because now we're in the age of analytics. But of course, this isn't an easy task. Data comes into different places, in different formats, dressed in different standards, and from this mishmash, it is very difficult to produce quality, reliable information that clinicians are willing to base life-affecting decisions on. We cannot just produce alerts and guidance, but we must be right about the alerts and guidance we're offering our clinicians. So in today's discussion, we're going to look at how to create and curate good, solid data, not only for clinical, but for financial decision-making. So let's go ahead and get started with our panel. So first, let me get our folks off of mute. There we go. First, I would like our speakers to offer just a little information on their backgrounds, their experience as it pertains to our topic today. Obviously, they've all done a lot of work in this area, and I'd like to start with Chuck Podesta. So Chuck, a little bit about what you're up to these days, where you're working, your organization, and where you come at the analytics topic from your experience and sort of your passion in this area.
Okay, thank you, Anthony. Thanks, everyone, for taking time out of your busy days. My name is Chuck Podesta. I'm the Chief Information Officer currently at the UC Irvine Health in Irvine, California. I'm in charge of the medical center IT, but also research and School of Medicine as well. Prior to that, I was the Senior Vice President and CIO at Fletcher Allen Healthcare, which is now University of Vermont Medical Center in Burlington, Vermont. And in Vermont, we actually we were moving towards a single payer environment in that state a few years back. And we had to stand, we actually were part of a couple of ACOs, both from a Medicare perspective and also a commercial insurance perspective. So analytics became really important from that perspective. So I really got into it a few years back, based on standing up those ACOs and putting in the technology that was necessary, and really could see the value of the analytics in a population health organization, well beyond just using analytics for operational uses and things like that. So then moving on to UCI, here we've got a large research organization. When I got here, we already had a very well-developed analytics platform based on a Hadoop Plus environment, and we're really building out a true, what I call a true ecosystem that will take us, into the population health world that we're moving into. But also we're doing some really cool things today with predictive analytics and prescriptive analytics and even beyond using sensor data and things like that are getting really exciting. So that's, you can see from the slide, that's actually the slide I put together is where kind of we are today on the right side in our evolution. I think everybody's trying to get there in creating that big data ecosystem, and we'll be talking more about that as we go along.
Excellent. Yiska?
Yeah, so my name is Yiska Braca, and I'm currently a health information technology scientist at RTI International, which is a private nonprofit research firm. And RTI has a long history of doing research in surveys, and it does have a Center for the Advancement of Health Information Technology, which really focused its attention for the past 5 years on the points that Anthony raised in the beginning of this slide, and now it's moving into analytics, and that is one of the reasons that I was brought in. Prior to being at RTI, for 5 years I was leading the data analytics team at Cincinnati Children's Hospital in the quality improvement department, and for 5 or 10 years before that, I was working with attempting to do analytics using the data that were coming out of electronic health record systems and claim system inside delivery systems. So I have direct on-the-line experience with the challenges of extracting data and making sense of them, and even the staffing models, how you get the attention and commitment from the local CIOs when there are many other competing priorities. In the movement from being inside a delivery system into research, and this is a relatively recent move, so one of the things that I'm seeing is that the global research environment is also very quickly moving toward e-health data, being able to harvest and make use of data that are coming in from sensors and mobile devices, being able to merge data together that are coming in from multiple providers who are using multiple EMR systems, which creates a whole host of other challenges in matching that data up and finding the same patient in multiple systems. So the world around analytics and data management is accelerating very, very rapidly right now.
Very good, very good. Russ?
Hi, good afternoon. Russ Lawrence. I'm with Optum Insight, and I work in our data management group. I've been a part of our data management group for about almost 3 years now. I've been with Optum for almost 5 years, or just a little bit over 5 years. My background is in data warehousing, data management, and ETL architecture. In the last year or so, I've been working in our data enablements and analytics component area, where we are seeing, with the amount of data that's increasing on a daily basis from the number of EMR systems, from the number of different types of systems in a health system or a provider system, how do we use new technology to marry the technology to the business strategy to understand and how to help organizations integrate this information, define complex relationships, and then report that information to the appropriate peoples at the right time to help them in using complex analytics to help them make the next best decision and then also integrating that within their workflow to use that information as well.
Very good, very good. All right, I appreciate the overview. Now let's go with definitions so we get some sort of common ground here. And let's take these both at once because we've got a lot of questions to get to. So how do you define data management, and how do you define being a data-driven organization? Chuck?
Okay, on the data management side, actually I would go more into, I mean, if you look at this data management and data governance, I think they're tied closely together. I think you can't do one without the other. But anyway, on the electronic medical record from a data management perspective, it's really not, and I know there's a lot of EMR companies out there that are trying to get into the analytics space, but it's very difficult for them to do that because the EMR is just not built for that. It's not designed for that high volume velocity data. And so you see from the slide on the left side there that it's really built for an individual patient care episode of care for the clinician. So it's really important that, you know, you aggregate and move that data to some sort of enterprise data warehouse. But again, if you remember the evolution slide, most people are still in that data mart with visualization, that third group. You see data visualization with data marts. And that's what most people are right now with their data management right now. And what we need to do is move to the right and really create that big data ecosystem with it, certainly with the data visualization on top as well. So from a data management perspective, you really can't do that in an EMR. You've got to do that in the enterprise data warehouse. And you don't want to be in a situation where you're data mapping from source data that's, you know, as Russ said, you've got so much information coming in from different source systems that to be in a data mapping mode into data marts is just time consuming, and you won't get the results that you need to get in especially in a real time situation. So from that perspective, in my mind, it's just the data management is just much more complex and sophisticated because you are now moving that data into that enterprise data warehouse and in a real-time fashion, hopefully leaving it in its native form, and so it can be used in a variety of different ways within the data warehouse and be used quickly. And I think that's the most important part of where we need to go.
Yiska, you mentioned that, you know, you've had obviously experience in the trenches. So with that in mind, how would you define a data-driven organization?
I would define it much the same way that
Chuck?
Chuck defined it. I'd like to go back, though, to this concept of leaving the data in close as possible to its native form. I think that's where the tension is, especially when you get into data governance. So the issue that we faced in doing analytics at Cincinnati Children's and other places is that when the data are in native form, they are usually not analytically usable. They need to be transformed to become more digestible. And if you're doing analytics that are going to serve the organization as a whole, you need to have some agreement around the definitions of key terms. And if you have multiple people scattered across your organization attempting to do analytics, they are going to come up with different definitions of key terms, and there's going to be a lot of duplication of effort in an attempt to transform that raw data into something that is analytically digestible. So I think we have a little bit of a tension there between real-time, being able to use the data that you're getting in as real-time a fashion as possible, and at the same time gaining efficiencies and consistencies across the organization in how you do those analytics. That's my take on the situation. I know that we had more trouble coping with the chaos that was induced by having multiple people really trying to make sense of the raw form analytics than we did with the instantaneous consumption of information.
Excellent, excellent points and observation. Chuck, I will give you a chance, but let's hear from Russ first. Russ, what are your thoughts on what Yiska said?
Yes, definitely. I think I agree with both what Yiska and Chuck are saying. I think the data platform becomes the new area where a focus for what I'm seeing is a change in the data. So what Chuck was talking about with data model, data mapping, where data modeling is changing. We're seeing that you look at core dimensions within a health system's patient, provider, location, procedure, diagnosis. You start with a core and defining your complex relationships, and then now with the capabilities within a data platform where instead of before it was a mapping into your enterprise data warehouse, now you're going to actually have the capability of doing schema on read. So now you're actually going to be able to extend that at the point you need that information. You're going to be able to consume that into your visualization, your application, your statistical model application, your predictive analytics or your optimization model. And then wrapped around that, the other piece, looking at the data governance component, I think that's a critical piece where it's both at a high level, at a steering committee level that you need buy-in from your top level, but then also at a grassroots level, you need to also spread the information across and make sure that you have consistent definitions at a core. Here's the core definitions within the organization, and then from there, start disseminating that information to people so that people use the information correctly. So when people are looking at revenue or other metrics, they're using it in the correct term, they're asking the correct questions, and then they're understanding it. And then when they start building on their models, they'll be getting the correct results to use in their workflows, their analytic models, or their reports for the organization.
Chuck? Anything in there you want to respond to?
Yeah, you know, I agree with both Russ and what Yuska was talking about with the tension, you know, between the native data and the mapping of that data and the management of that data, and I think that's where the next evolution is that's coming with the technology, is to be able to handle that in an automated way, and Russ alluded to that as well. And as opposed to some of the tools and vendors that are out there today haven't solved that problem, but the ones that are coming out now have, and you're starting to see, we're actually working with one now that's doing some really interesting things with our Hadoop database, and in a way that it solves that issue of tension between the native data. And once you do that, now you can get into kind of the real-time predictive analytics, as Russ was talking about. But I agree with you, Scott. You know, until you solve that piece, then you still have that kind of manual process in place. And I think, you know, some of the vendors that are coming out on the early side of analytics are starting to realize that, okay, their platforms aren't set up to do that. Now they got to move to something different, and they're starting to go in that direction. But there are some new startups out there. I know Optum's doing a lot of work in this area as well, and some other startups that we're working with that do it, that are working in this area as well. So it's a pretty exciting time to be in analytics.
Great. Let's take an audience question. Let's start with you, Yiska. With respect to improving data collection overall, how do you handle and address potential patient or enrollee pushback? Any good pearls of wisdom you can share?
I'm sorry, Anthony, could you repeat that question just a little more slowly? Yeah.
Sure. With respect to improving data collection overall, how do you handle and address potential patient or enrollee pushback? Any good pearls of wisdom you can share if patients are pushing back on your attempt to collect a lot of data from them?
Well, so we've never really encountered that. I'm interested in knowing the source of the question. Generally, what we were doing was working with data that were byproducts of the ordinary transaction or encounter between the patient and the provider. And we didn't attempt to add a whole lot more into that byproduct, except when we needed additional clinical information for analytics that just didn't come natively with the system. The pushback that we experienced was not so much with the patients, but actually with the providers, because it just became burdensome. I mean, they didn't want to be data entry clerks. And honestly, did not exactly have a solution for that. Anthony, you mentioned earlier on the concept of scribes. For patient-reported outcomes, we sometimes push that to the patients themselves. They would complete a questionnaire while they were sitting in the waiting room waiting for an appointment, and that they enjoyed doing. They enjoyed filling that in. So I guess I don't really have an answer to that question, and I'd be curious to know what the questioner experienced that raised it.
All right, well, if the individual asked that question wants to send in a little more color around it, we can address it a little further. But let's move on. Let's talk about the impetus to the world we're moving to. What market and policy decisions and forces are making analytics an organizational imperative, and what is the business case? So there's policy issues, we all know. CMS moving to value-based care for a large amount by the end of this year, and then a much larger amount by the end of next year. So we know what those policy forces are. I think we know this is the right direction. What about the business case? Why don't we focus on that one? Russ, you want to touch on that? What do you think the business case is for being data-driven?
Yep, definitely. I think it's a shift in the culture. First and foremost, so what Yishka was talking about a couple answers before, I think what we're seeing is a shift in the culture. So not only is it realizing that the value is in the data itself, but then also the right context, making sure you have the right context around the information. That's where the information becomes very powerful. So when you start looking at your data governance strategies, you start looking at how this information should be interpreted, and then also looking at use cases where you can actually go after new opportunities within the organization to help identify problem areas where you can apply the analytics to make better decisions, and at the same time looking at understanding that you use this information to become a high-performing organization. You know, part of it's the implied notion that there is somewhat of a data strategy in place, and that it's a maturation process. And then when you're actually becoming that and moving to wanting to be data-driven, it indicates your desire to become a high-performing organization as well. And it's also looking at how do you improve your revenue, reduce cost, avoid fraud, as well as improve patient and customer satisfaction.
Great. Let me move to you, Chuck. When you're in a board meeting and you're talking about finances and budgeting and why you need all this money to be data-driven, how do you talk about issues like ROI?
Sure. Well, I'll give you an example. You know, you talked about population health and moving towards value-based care. So let's assume we're in that world right now for at least a portion of our patients. So in that particular case, you know, if you just take one of the drivers that you're going to get reimbursed on, let's say cost, you want to keep the patient in the lowest cost setting as possible, which is in the home. So now sensor data becomes very important, you know, the wireless scales, things like that, depending on, you know, what potential chronic condition the patient has at this point. So those are the ones at the highest cost. So you want to keep them in the home as much as possible. So now you've got to, you know, from an analytics perspective, you've got to collect that data on that particular patient while they're in the home. Let's assume that now, you know, something's happened in the home. The sensor data is telling you that, you know, this patient needs to come out of the home and get to some care, whatever it might be. Maybe it's a diabetic patient. They haven't had their A1C test in 6 months or something like that. So the analytics is telling you that they need to go see their primary care physician office. So in the primary care physician office, every morning they would see a list risk stratified by the patients, the highest risk patients to the lowest risk patients. And these are risks of patients ending up in a higher cost setting like an ED, or urgent care or something along those lines. So now your primary care physicians are reaching out to those patients and saying, we need to see you right now because of this particular issue. So that would be the next lowest cost setting. So what you're trying to do is really keep that patient into that lowest cost setting at the highest quality, of course. And you can't do that without the analytics, as you can see. You know, you can't, unless you can risk stratify those patients based on the sensor data, based on other, you know, EHR data and things like that. There's no way to keep that patient into the lowest cost setting, or even give the providers that information where they could possibly do that. So that would be just one example where you can't be successful in population in a value-based world, without it.
Excellent. So that's a good tool people can use your answer for when they're in those meetings. Yiska, I'd like to go back to you. We talked about the concept of altering data so that it's useful, and we talked about the idea of being in its native format and manipulation and these kind of things. In addition to that, do you want to touch on why extracting data is so difficult and also the greatest pain points for a data-driven organization?
The extraction, I think, can be relatively straightforward if you've got the IT support. And so this is, for a long time, we didn't. I mean, that was part of the problem. But now that this is becoming more of a cultural imperative, that's becoming more and more common. It's the transformation of the data into something that's analytically useful that is difficult. And the transformation is both a technical feature, but more and more it's a definitional feature. When the data come to you, like I said, we're usually dealing with the byproduct of an ordinary transaction, and it's the collection of that data was really not designed for analytic purposes. It was designed to meet those front-end needs of supporting the transaction. So in order to transform what you're getting in the raw form into something that's meaningful and useful, you have to engage in a lot of definitions that are commonly understood and commonly used across the organization. And this is where the data governance feature becomes just so critical, because unless you're doing that in a systematic organization-wide manner, you are inevitably going to get inconsistent definitions coming from all the different people that are trying to do this on their own independently. So if an organization is really in the early stages of trying to become a data-driven organization, I would say this is one of the things that you need to be aware of early on, that gaining agreement around, for example, what we mean by a visit, what we mean by a current patient, and those are really common examples, they're trivial examples. Once you get into specific clinical terms like rare conditions, it becomes even more challenging. You can't escape that need.
Mm-hmm.
Very good.
Anthony, I can jump in here. I think, the one thing when Yiska was speaking is that I always come back to is having metadata about the information, common definitions, and then publishing it and making it available for the broader organization. You want to make sure that everyone has access to that information to understand the context of when the information, how it's defined, the sources, where it's coming from, so that everyone understands that and everyone works from the same spot. So when you start defining your complex relationships as part of your data management strategy, data governance strategy, you need to define that and publish it and have everyone agree that this is how we define a visit. This is how we define this attribute. And then from that point forward, making it analytically useful becomes that much more easier.
I completely agree with Russ. And I would say that organizations that were early adopters of analytics in some ways may have a harder time with this than organizations that are just starting out. Because if you're just starting out, you can be aware of this problem and kind of design for it and build for it ahead of time. If you were an early adopter and you were not aware of this, then you are probably facing a kind of chaotic situation right now, and your need is to tame that chaos, which is harder to do once it's been unleashed than before it's been unleashed.
Chuck, does that make sense to you?
Yeah, it does. I agree with both Russ and you, Scott. The only thing I would add is that I think what you're going to see, and I totally agree, people who started early are going to have a tougher time. Some of it is because of the platform they're on, because they're on a SQL-based platform, which isn't going to cut it, going into, looking at, the center of the universe of a data warehouse. You can see what we built on the slide here. It's a Hadoop-based. If that was SQL, there is no way you could plug in these other data repositories and open source data and use all these visualization tools against the SQL database in a real-time type of environment. It just would clog up. There's no way to do that. So, but the other thing I would add too is I think in the future the EMR is going to be, it's going to be important, of course, from a source data perspective, but it's going to be only one of many. And right now everybody's focused on that from a data governance perspective. But we're bringing in social media. There's data.gov resources. There's all kind of open source data. There's subscription data out there that you can get on how people use cell phones and things like that. There's apps. I don't know how many 100,000 medical apps are out there as well that will be source data. So this will be, I know it's an issue with the EMR right now, but you can imagine as you start bringing in all these other source data in, you better have solved the T and ETL before you get into that world. Otherwise, you won't be successful.
All right, very good. At this point, we're going to give Russ Lawrence the floor for a few minutes to deliver a little mini presentation, then we'll get back to our Q&A. Russ?
Thank you very much, Anthony. On behalf of Optum, we appreciate the opportunity to sponsor this event and the webinar on rethinking data management for innovation and growth. Thank you to Anthony and the other panelists, Yishka and Chuck as well. As part of Optum's Connect IT program, our IT and transformation solutions are structured to support internal and external market pressures. This program aligns and supports business and technology strategies for the provider and the health system. Technology functions are instrumental in shaping an organization's ability to drive a positive patient experience, meet regulatory requirements, and manage costs. Technology has become a more valuable corporate operation than ever before. It is no longer a peripheral service. Every department and staff person utilizes services from the technology team on a daily basis. As a result of the technology being integrated with daily operations, technology must be included at the highest level of business planning, projections of growth, development opportunities, and improving operational efficiencies. With a more strategic role, CIOs are continued to be pressured to reduce costs while maintaining compliance, data privacy, and security, improving security levels to keep pace with new technologies, and ultimately providing the best experience for their stakeholders. From a Gartner survey of providers, the focus of technology departments is to drive down day-to-day operating costs. Strategic alignment between technology teams and business partners allow CIOs to harness the power of modern infrastructure and applications to meet the mounting business demands and invest for expansion, transformation, and growth. Technology departments often struggle to sustain day-to-day operations, are in a fierce battle to recruit and train top talent, and optimize application portfolios. The level of investment required to keep the lights on makes strategic growth initiatives challenging and difficult while transitioning to value-based care. These factors require many provider organizations to adopt a new approach where IT is a strategic partner to clinical and administrative functions across the organization. Optum is a health services and innovation company that believes modern healthcare works better with more pieces connected. We partner with CIOs of hospitals and health systems across the United States and internationally to combine rich data and analytics with our technology expertise. Our objective is to connect technology departments to the needs of clinicians and administrators to prepare for value-driven care and to simplify operations. We focus on four core transformative areas of technology departments: data and analytics enablement, deploying data platforms to uncover actionable insights and drive innovation from increasingly voluminous, complex information across the health system, patient experience and social collaboration, enhance how patients, clinicians interact with and work together for better health outcomes, infrastructure services, a secure, reliable, and efficient foundation for as-a-service capabilities that offer greater scale, flexibility, and agility, compliance and privacy, manage and respond strategically to multiple compliance, privacy, and security challenges. Optum's mission is to help make the health system work better for everyone. And thank you, Anthony.
All right, very good. All right, appreciate that and appreciate your sponsorship. Now we're going to get back to our Q&A. and I'm going to take us to the how-to slide. So how do we go about accomplishing some of these things? Let's look at these questions quickly, and then I'll ask our panelists to sort of pick one that they want to run with. How do you start a project? What technical infrastructure and process must be in place before you start a project? Who is the organizational leader, and how do you create collaboration? I think Yiska is going to speak to some of that when she referred to buy-in. What personnel are required to succeed? What governance is required? This is going to be a good topic. What kind of leadership is required? How do you engage physicians? And we know that's difficult. And to be successful, data-driven decisions should not be siloed. How do you prevent that? So Yiska, do you want to look at those and just pick one and run with it?
I'll start with the personnel. So I think the key insight here is that in order to go from the raw source data to actionable insight, no one person and no one team probably has all the skills necessary to do that. It's a sequence of actions that need to take place, and there's expertise assigned with each sequence. So your people in IT might be very good at the data extraction, data cleaning, and loading it into the final form, but the analytic people are going to have more expertise probably in drawing out what the clinical questions are, what the operational questions are, and translating those into something that the data that you have can be, that can address. And then, and that skill set in the translation leads to the definitions and the governance issues. So I think one of the, again, this is mainly for, well, it's for organizations just starting out and those who have been at it for a while. The awareness that you need a multifunctional team that works together, I think, is key here. So I'll stop there so that others can jump in and answer the questions that most speak to them.
Chuck, you want to touch on anything Yiska said, or jump into a different question?
Just to touch on a little bit on the personnel side, because I think that's extremely important. Because I think what Yiska's saying is absolutely right. Things are changing, and people who have started early, their analytics teams are made up of the the extract, transform, load people, the mappers, SQL programmers, and of the like. In moving into the new world, with population health and having all this other data coming in and building an ecosystem, you're really going to have to transform that team into, you need data scientists for sure because of the complexity of the data. There will be distributed computing involved, so you need expertise in that. Cloud, certainly, because everything is moving in that direction from an analytics perspective. Hadoop Plus versus SQL, so you need expertise in Hadoop types of environments. Data visualization tools and expertise in those areas as well, which typically may not be on a analytics team. And then we're also adding in, we're actually looking at it here, a cognitive and behavioral psychologist, because you're looking in a value-based world of trying to get people to change their behaviors. If they're a diabetic, making sure that they're exercising appropriately in their diet and things like that. And what are the triggers in that individual will get them to change their behaviors so that they're more healthy behaviors. And that's a very difficult, that's to me is the secret sauce, and that's a very difficult thing to do. But that's the only way we can survive in a population health world, a value-based world. So you're going to need those people on your team as well. So I think that those are the areas that people start, when they think about analytics and their analytics team, start thinking about those types of individuals as opposed to what's currently on their analytics team.
Russ, do you want to touch on any of that or jump into another question?
Yeah, no, definitely. I think both what Chuck and Yiska are saying are absolutely correct. And then to build on that, the guidance that we provide is really looking and defining your use case and what is the actual outcome. So work from the end in mind, work back, and to try to keep it small and time-boxed. The big data technologies, there's a ton of information, there's a ton of tools, technologies out there, and it's very quick. If you start integrating and trying to integrate too much, you're going to get swamped, and it's going to cause chaos. So what we look at is saying, how do you define your use case, and then make sure you select the appropriate technology to support that use case, and then prove that out and show the value so that when you're asked about it, you have that solution in your back pocket. You can bring it forward and say, here's the solution, here's the use case, here's what we did, this is how we support it with this technology. Albeit it may be very narrow, but it actually starts getting your organization and starts shifting the mindset of going from the old SQL world to a different world, the new world of the big data, where data modeling is changing, data mapping is changing, schema on read is the new where things are going. So how do you make that, and then also data quality, data governance, how do you wrap that into your use case to show the value going forward, all while trying to time box that in a 90 to 120-day period.
Yeah, Anthony, just to add to that, I couldn't agree more. I mean, you don't want to buy into a framework that doesn't allow you to move around. And that's why I like to call it an ecosystem, because if you think of an ecosystem, it's something that's growing and changing in a real-time fashion. You don't want to be on a platform where you're constantly going back to the vendor every time you need to add a source system or make some changes to that system or create another use case. You want to have it be really a self-service model, both for you individually in your organization and for your customers and your users in your organization. And the only way you can do that is not making sure you're not boxed in on a framework.
Yeah, I agree with both completely. And in fact, I can see the back and forth there. You get started with a particular use case because that's the best way to get momentum, and it enables people to wrap their heads around it. But you don't want that use case to lock you into whatever might come next. So part of the decision-making criteria for what that use case is how can we use this as a springboard or a platform for the next use case and the one after that and the one after that. What you don't want is your use cases to become siloed. You want them to emerge as an integrated into the ecosystem so that when you're looking back after a couple of years and you've got a number of use cases on under your belt, what you have is an orderly ecosystem rather than fragmented chaos again.
Mm-hmm. Absolutely. Yeah, that's right on the money. It's really that's the core of your data management strategy. Putting some guardrails or boundaries up to begin with, that's your framework that you want to build and adhere to. Look at your production support model. What is your support model? Work back. Then put the boundaries up for development, framework, the tools and technologies you're going to use, and then consistently use that and then build within those parameters. And then as you build each use case, your data management strategy will mature.
Mm-hmm.
Right. And the other component to this too is that you don't have to bring everything into your data warehouse. You know, one of the things you've got, and this again is building your ecosystem so you're not locked into any one platform, because you know, things like genetic data is so large. Some of these data sets are so large. The last thing you want to do is be pulling them in to a data warehouse. Imaging data, which is going to be important going forward. These huge data sources. So you want to be able to reach out to those in a real-time fashion and utilize those databases, but not actually bring them in. So when you think about that ecosystem, it's not just your individual data warehouse. It's being able to access a lot of this data, you know, across the different environments in a real-time fashion. And again, you can't do that by getting yourself locked into a single use case and a single framework.
All right, great. Let's go with the quick final thoughts around 30 seconds each. Your key takeaway to some CIO out there just struggling, having a little trouble, and just looking to get some direction on how to move forward in this area. Russ?
Definitely. I think it's really getting back to the fundamentals of looking at your core data management strategy, looking at governance, adoption, report management, complex relationships, data integration, your strategy, and platform scalability. So making sure that you're conscious of those components and then build within that framework to start articulating what the long-term strategy will be.
You just got 30 seconds, please.
Okay, just to build on what Russ said, I would say once you have the big picture in mind as he just described, but then to get started, if you haven't started already, find a use case. And one of the criteria for choosing a use case is a leader that understands this and is going to be a champion for you. And it's the single and the next use case that actually starts to build out that strategy.
Chuck, last word.
2 points. First, get used to source now, ask questions later. Healthcare evolves with data, and it's not a point-in-time construct any longer. The second point is get used to working with constant change, disruptive trends, and something new that will make your frameworks obsolete. And again, building off an ecosystem type of strategy is the way to go.
Excellent. Well, that was really, really good. I want to thank our panel, Chuck Podesta, Yuska Braca, and Russ Lawrence. I want to thank Optum for sponsoring. As I mentioned, you'll receive an email when our archive recording has been posted to YouTube, and then you can go ahead and view that. For those of you who have the CHIME CHCIO certification, attending our webinars gets you 1 CEU. If you've asked us to communicate that to CHIME, we will. Otherwise, don't forget to let them know. Sponsorship opportunities, contact Nancy Wilcox. General questions, comments, you can reach out to me and go to our website to see our robust upcoming schedule. So with that, I want to thank our panelists, Optum, and our attendees, and everybody have a wonderful day. Thank you.